There's new information right now from the World Health Organization. It's advising pregnant women to hold off on getting the Moderna vaccine.
Now, this is similar to the advice it gave for the Pfizer dose earlier this month. Channel 3 Eyewitness News reporter Matthew Campbell is joining us now live. And Matthew, what's the reasoning behind all of this?
Well, Aaron and Mark, it's because the initial trials for the vaccine didn't include pregnant women, but this recommendation could change once further studies are done.
It's definitely nerve-wracking being pregnant and having a pandemic happening.
At 28 weeks pregnant, Kate Matson admits there's a lot of unknowns this time around.
You just don't know how it's going to affect you if you get it.
According to the CDC, they write, quote, pregnant people with COVID-19 have an increased risk of severe illness. Additionally, they might be at an increased risk of adverse pregnancy outcomes, such as preterm births. So it's understandable why the CDC has pregnancy as one of the 11 conditions that would put someone at an increased risk of illness, which in turn qualifies them for Phase 1B of the vaccination rollout. Matson says her doctor hasn't given her guidance.
I was kind of wondering when they were going to say something, whether or not it was a good idea, bad idea. Honestly, I don't personally feel comfortable getting a vaccine that I don't know a lot about.
Tonight, the World Health Organization is recommending pregnant women hold off on both Pfizer and Moderna vaccines unless, quote, the benefit of vaccinating a pregnant woman outweighs the potential vaccine risks, such as in health workers at high risk of exposure.
Right off the bat, my husband was like, nope, you're not getting it. Knowing, like, because obviously, he's concerned and he's worried about his unborn child as well.
The WHO says the vaccine shouldn't affect any other aspects of a pregnancy. Breastfeeding can continue, and the WHO does not recommend doing a pregnancy test before getting vaccinated, nor does it recommend delaying pregnancy following a vaccination. In the meantime, women like Matson are staying safe.
I'm trying to be as careful as I can, but I still have to go to work every day. I still have to take care of my 3.5-year-old daughters.
Now, we reached out to multiple doctors tonight in an attempt to get their insight into the WHO's recommendations, but none of them were available. However, tomorrow we will have a Yukon doctor tackle this very subject on Eyewitness News tomorrow evening. For now, live in studio, Matthew Campbell, Channel 3 News.
All right.